Hi, my name is Victoria Lasota, and I'm an occupational therapy student at Cleveland State University. The focus of my capstone project was on positive mental health promotion in people living with Parkinson's disease, and this was done through engagement in creative occupation. So, why is this topic important, and why did I choose to address this issue? Non-motor symptoms such as anxiety, depression, and apathy are commonly experienced by people with Parkinson's disease. These symptoms stem from the loss of dopamine-producing brain cells, which can greatly influence the quality of life and successful participation in everyday living if left unaddressed. So, in response to this need, my 14-week capstone experience focused on developing and implementing the Creative Connections program. And what is the Creative Connections program? So this is a community-based creative arts program designed to promote positive mental health through self-expression, social engagement, and community involvement. This program took place at In Motion, which is where I did my 14-week capstone experience. This is a nonprofit wellness center for people with Parkinson's disease. My program was 3 weeks long with a frequency of one time a week with 1 hour long sessions. And during this time, I ran 2 parallel groups, and each group had 6 to 8 members. I just had to maintain that number just to ensure its effectiveness for the group sharing and processing portions that I also had in my program. The creative occupation of choice was a collage-based visual art project. So we made decoupages in all 3 sessions. We added on new theme-based content to the same collage each week. We used pictures and words from magazines that related to the theme of that session. So now I will go over the different sessions and the themes that are related to it. So session 1 was the theme of joy and hope. Session 2 consisted of goal setting, and session 3 was reflection and application. And in addition to collage making, education and handouts on a variety of coping strategies were also introduced to each session, really allowing the participants to translate the strategies into daily life or routines. And this was a really important aspect I wanted to incorporate into my program, was to make sure when my members leave, they still have something they can do at home and really carry on over the things that we have learned and use different strategies besides from just the creative occupation. The structure of this program was developed based on the focus groups that I ran personally during the first few weeks of my experience at In Motion. And this is also in addition to my literature review. And this really allowed me to gain insight from the Parkinson's community directly on what type of challenges they experience living with Parkinson's. Some key findings from the development of my implementation of my program was that it fostered community and social connectedness, meaningful relationship among peers formed, where the members were able to get to know each other on a deeper level that they usually are not able to in the different kind of programs that In Motion has to offer. There was a lot of group discussion and reflection, and that also played a factor into fostering those relationships and meaningful opportunities. And the activity of doing promotes processing and sharing among the groups. So I found that when the members had a project to work on and using their hands and just doing an activity, they were able to reflect back on the experiences and feelings that they may have felt maybe more easily rather than if it was just talking about it. And it also invited an exploration of creativity and new interests. So what are some implications for OT practice? The therapeutic use of creative occupation is an effective approach for positive mental health promotion and management on non-motor symptoms in people living with Parkinson's disease. So in conclusion, this occupational therapy positive mental health promotion program fostered a strong sense of community, emotional well-being, and meaningful peer relationships. And this really demonstrates the therapeutic value of art-based interventions in the occupational therapy practice. And thank you for listening.